Hello and welcome to Elemental TV. Today I am joined by John Lodge, Head of Quality Improvement, London Region at NHS England and Improvement, and Dr. Hisham Abdallah, who Consultant Paediatrician at Walsall Healthcare NHS Trust. And that's just their day jobs. What we're actually here to talk about today is Hexitime, which is an innovative new project that is being launched. So welcome to John and Hisham.
Thank you.
Lovely. So just give us an overview of the project to kick off.
So Hexitime is the first and currently only skill exchange and time bank for the health and social care system.
Okay.
And we focused Hexitime in the field of improvement work. So you join this digital platform called Hexitime, hexitime.com. You can create a profile, and on that profile you can then post offers of your time to the system, or requests of other people's time from the system. And the platform is based around these offers and requests of skills that you need in the improvement work that you're undertaking. You then find your skill exchange, share information through a confidential messaging service, and then ultimately exchange credits on the basis that 1 hour equals 1 credit.
Okay.
And it enables you to then spend your credits on your own improvement work and share that improvement expertise across the system. And money never exchanges hands.
That's amazing. So, I mean, where did this idea come from? What's the driver behind this?
So we were both really talking about this for a number of years in our own parts of the country. In London, I was talking about a need for a skill exchange. I likened it to Gumtree.
Okay.
I was saying we needed a Gumtree for the NHS where people could post their expertise.
Absolutely.
People could find them, and then we could meet up and exchange them without a need for all the expensive alternatives. And then I'll let Hisham
I
jump
came at
in.
it from a slightly different angle actually. So I was doing a lot of community work, and I saw this kind of idea of time banking in our local community, which is based on the similar principles John described. You give an hour, you get one back, and it helped catalyse connections within communities. There's a lot of value in giving as well as receiving time, and it helped connect neighbours who may never have talked to each other about any other point. And what I realised is actually, even in my system, in healthcare systems, we're also working in silos, we're also resource poor, and we also often need time and help to connect with people. So I thought, can this time banking idea work for doctors, nurses, managers within healthcare who are also looking to try to connect and in the purpose of improving their service?
Lovely. So it's great. You've got a real mix of business drivers and clinical ones as well, which has made this a good combination. How did you finance this?
So we'd both been talking about this in our respective areas for a few years, and it was the Health Foundation that picked up on these conversations and recommended that we start talking to each other. So they introduced us to each other in London, and we started sharing our ideas, the time bank, the skill exchange, and realised very quickly that we were onto something here, and we could create something quite meaningful and powerful, and we complemented each other's personality and skill sets quite well. So we pulled this idea together and built a prototype, a little £600 prototype, tested it with about 400 members of the Q community. And then to answer your question, we ultimately took that prototype to a grant innovation competition called the Q Exchange that the Health Foundation hosts. And we came out as the top voted project in 2018.
Oh, congratulations!
And thank you. And they awarded us £30,000 to take this concept and prototype and to build it.
Wonderful.
So we took the £30,000, built this into the platform you see today, and launched it in April 2019.
Fantastic.
And for the very, very early days, it was financed through grant funding, through the innovative nature of it. Moving forwards, what we must do is make sure this platform is free at the point of use for individuals using it. So you need to be able to log in for free, but it needs to be financed behind the scenes. So we're entertaining what we call like a strategic partnership. We go to big system organisations like ICSs, PCNs, academic health science networks, any other number of strategic acronyms. And we show them the idea and the concept and how this is beneficial for sharing skills across organisational boundaries in their systems. and we get investment behind the scenes at that level to keep it free at the point of use.
That's great. So you need that kind of funding, to be continuous throughout the life cycle.
And it maintains it's entirely as a not-for-profit.
Yeah.
So we bring money in, we invest it into the platform, make it more user-friendly and better for people using it.
Wonderful. So, you must have come across some challenges along the way. So any particular that stand out?
So every conversation I've ever had with anyone about Hexitime has been met with energy, enthusiasm, and people get the benefits that will come
straight away.
Both to them as healthcare professionals or by proxy the patients they look after. The challenge is actually not been engaging them, but actually ironically finding time for those individuals to start working with us within the platform. Either individuals just to log in, register, and look for offers and requests that may be a benefit to them. That's oftentimes, that little bit of investment at times is often the hurdle that they need to overcome. Or organisations who don't necessarily have the headspace to start thinking about how this can work within their organisations. So for us, the challenge is to make this as easy and as intuitive for people to get the benefits and see how much it will help them.
Absolutely, fantastic. So, presumably you've had some governance, issues. This is where people are exchanging information, exchanging ideas. Is there anything particular that's cropped up there?
Yeah, so I should probably say that we've worked really closely with this fantastic organisation called Made Open down in Cornwall, and they've helped us to write the code for the platform.
Yeah.
And in doing so, they've brought lots of expertise from the time banking world and their history around some of the governance. So, for example, we had to make sure the platform was fully GDPR compliant.
Of course.
So it's all been reviewed by legal teams through Made Open, which was taking a massive weight off our chests. But we need to make sure that users are first and foremost adults. So when they join, they agree to a terms and conditions to say that they're adults and they understand that they're not exchanging money and that this is for social good. And we have to pay close attention to who's actually exchanging time through the time bank. So the first barrier to entry is just an email address. But then if you actually want to start exchanging hours, we do a quick validation check where we make sure you're in it for the right reasons. We sort of check your background before we give you that second level access to the time banking platform. And as we develop and progress, we'll make sure that the confidential messaging service is safe and being used for the right reasons.
As I said, when it gets more and more complex, because this is cross-boundary, isn't it, in terms of organisations that can get involved. So, my mind's racing in terms of the potential benefits with this. What are the benefits that are being realised at the moment?
So I would say that the main customers here, really, in terms of who's going to benefit, are people like you and me. Patients who access healthcare services at the time of greatest human need, and for any of us who've been waiting in A&E for more than 4 hours, or been, having family members who are on waiting lists. We all know how stretched the healthcare system is. And as a professional working within that system, I also want to improve the service I have, but often don't have the time, resources, or access to expertise to make those changes, to make it more effective or efficient, and to increase the quality of care that I really want to deliver. So the benefits will come via healthcare professionals who want to improve their care by connecting them up to individuals with like-minded individuals, by giving them access to ideas, resources they wouldn't actually have otherwise. And the third level of benefit is to those organisations. And again, working in healthcare, I can see how sometimes perversely bureaucratic it is to try to find resources. There's been times I've been trying to get help within the organisation, but just simple things like paying invoices to people can take months or even longer.
Window gone at this point.
Exactly. So by providing a low bureaucracy, or ideally no bureaucracy way of accessing resources, connecting like-minded professionals who want to help improve their services, the benefits will come to patients who actually need NHS and social care.
Fantastic. My mind boggles really with the potential that this has in terms of cost savings for the NHS, because the skills, like you say, they're there within the NHS, so it's about sourcing them and sharing them. Are you able to identify any cost savings?
Yeah, so we know that the skills are in the system, and most of the time they're being paid for by the taxpayer. We just didn't have the exchange to find them and work with them. just on your point there around timeliness, I mean, in the early days, sort of when I needed an analyst to support my team in improvement work, I'd have to go and advertise for them with advertisement costs, recruit them with recruitment costs, and then pay for them, you know, over and above the market rate because I'm bringing them in externally. And all of that at probably a 4-month time delay, so that I get the person 4 months after the project has required them. So by time banking, we're tapping into all this expertise that we know exist and are there being paid for free, taking out all that recruitment, advertising, delay cost, but then also we're taking out the hourly rate of that person. So we've got some fantastic examples on the time bank at the moment. A really nice one is a chap called Adam Saul-Jones, who used to be the National NHS Director for Improvement, and he's offering his time to deliver board level seminars on the platform to hospital provider boards around setting up improvement approaches. So a seminar of that quality at that level on the open market would comfortably cost about 10 grand for that level of expertise and time. Through Hexitime, boards are getting that for free.
Fantastic.
And in an environment where we frankly don't have enough time and money in our services, it feels like an incredible opportunity. And then of course we've got everything in between that, where we're saving the cost of people's time and not having to pay over the odds to get it from elsewhere.
At £1,000 a day or whatever. I mean, for Hisham, for you, this wasn't all about the cost savings. I know there's an element of social value in here that was quite close to your heart.
Yeah, and very much so. As I said, starting off with that idea of time banking within the community, I see in healthcare, professionals working in silos on problems that have been solved elsewhere, oftentimes feeling more and more disparate or kind of isolated within what they're doing. We're actually connecting individuals within the healthcare system to others who have got similar ideas, who may have solved these problems elsewhere, adds a lot of value. And in fact, the evidence shows that giving is oftentimes as valuable or even more valuable than receiving. This idea of giving a resource pro bono to a stranger adds a huge sense of well-being, because you discover assets that you didn't know that you perhaps had, and that kind of idea of concentrating on what you can give rather than what you need is really valuable. As well as the kind of second aspect of kind of catalysing connections within communities. So, I mean, for any of us who've been to conferences, you'll often know that the most valuable part of that conference may have been the coffee table conversation.
Yeah, absolutely. Some of the best deals are done there.
Exactly. So whereas by a way of actually connecting up people to have those conversations, oftentimes it's not the exchanges themselves that people get the most value from, it's the circumstantial discussions, adds a lot of well-being to both recipient and donor of those exchanges.
That's fantastic. This is a no-brainer really for the NHS, isn't it? In terms of what's next, what's coming? What are the projections in terms of the growth of this?
So it's an exciting time. It feels like there's something new popping into our heads every week as we develop this. Structurally, the first thing we're doing is we're going to become a community interest company. So we learned in the last couple of months that we were behaving like a charity, and our principles and ethics were driven for social good, but of course we weren't getting any of the benefit of being a charity. So we're going to restructure to become a community interest company, and that's going to open the doors to lots of grant funding to make sure that we can sustain this and keep it free at the point of use. So that's quite exciting. In terms of our team, we're expanding. We're going to double over the next couple of months by bringing in Hexitime internships. So we've got an intern joining us from Montpellier University coming across, and we've also got a management trainee from the NHS Graduate Management Training Scheme joining us. So our team's going to double. In terms of the platform itself, we've responded to how our users feedback, and we're bringing in additional functionality. So for example, you'll now be able to host a private project team space on Hexitime. You'll be able to manage members, do project management, file sharing, be able to undertake surveys and have private chat rooms on Hexitime, feeding back, just responding to feedback really from our users. We're going to introduce functionality so you can float ideas. So you don't have to come to the platform as an expert with a really long history of the skill. You can just have an idea for improvement, upload it, and let the community build on it and help you to develop that idea.
Yeah.
So lots of functionality coming in as well. And then in terms of the way Hexitime is used, I think we want to mature beyond just individuals trading time ad hoc.
Yeah.
And try to go to an organisational level where we get an organisation rounding the people within it
They'll see a lot of value at this
to share
level.
skills for a particular call to action.
Yeah.
So it might be, as we're developing with one of our partners, Walsall Together, reducing length of stay amongst elderly care patients. We can get the phenomenal potential of the skill sets of our people to focus on one thing. And then finally, I guess the logical progression is to take it to big system level, where we get the hospital to focus on that with the voluntary sector, with social care, and we can harness the potential of skills and time bank around particular calls to action. And then just to finish on that, so we're developing strategic partnerships.
Yep.
So we want to bring in the power of big system partners with their investment and their expertise and their contacts, to make sure we can get the benefits of Hexitime to their staff and their users and their communities. So 2020 is going to be exciting.
It is.
There's a lot going on.
And there's a very clear message there as well. So partners, investors, let's get involved. Yeah. It's been an absolute pleasure. I think we're out of time now, but thank you, John. Thank you, Hisham, for coming along today and talking to us, and best of luck with this fantastic project.
Thank you.
Thank you very much.